Morning. My topic is slightly out of place, I feel here. Uh, Nevertheless, I'll go ahead with it. I'll be speaking about low vision rehabilitation. Now, there are certain points to remember before I go into low vision. We all know visual input is a major source of information, and reduced vision means reduced information, and it has impact on our development, motor skills, language, and social abilities. We should also know that situation of people who fully lack vision, that is blind people, is different from those who have some vision which can be effectively used. And maximum use of low vision, it reduces the impact of low vision in children. By definition, a person with low vision is one who has impairment of visual function even after treatment and standard refractive correction, and who has a visual acuity of 6 by 18 to light perception of visual field less than 10 degrees. But the most important point is he uses or is potentially able to use that vision for planning and execution of a task. Now, if you look at the figures, the number of low vision patients is almost 3 times the blind people anywhere in India, globally, or even in Asia. While low vision care, the basic skills of low vision care are very much part of eye care. And knowledge of low vision, it enhances our understanding of disease consequences and patients' complaints. It increases the effectiveness of medical, surgical, and optical rehabilitation. As an ophthalmologist, we should understand the role of ophthalmology in low vision care. We should be able to identify low vision patients, assess patients' functional impairment, and we should be able to integrate the components of low vision care and visual rehabilitation. We should know what are the vision rehabilitation resources available for our patients in the vicinity. And modern low vision assessment is not a mystery. It follows the same protocol of any eye examination, but with more importance to task related history. Apart from visual acuity, we need to check contrast sensitivity, glare testing, visual field testing, color vision testing, and if available, laser interferometry and scanning laser ophthalmoscopy. Uh, Low vision devices can be basically classified into optical and non-optical devices, and fundamental instrumentation in all these is magnification, illumination, and contrast. Optical devices, I don't have time to go into details of advantages and disadvantages of all the devices, but we have optical devices in the form of hand magnifier, telescopes, spectacles, and stand magnifiers. Then we have electronic magnification, which utilizes a camera and a zoom lens and electronically projects image on the monitor. Now, these are certain devices which are used as to complement the low vision devices, like tinted spectacles or clip-ons, photochromatic lenses, filter lenses, and tinted contact lenses. There are lots of non-optical aids available, like signature guide, typoscope, bold line notebooks, felt tip pens, reading stands, letter writer. They all again complement the optical devices. Now, recently, the technology is playing a bigger role, which is evident in devices and equipment which is used by patients and in assessment tools. Technological advancement has brought major changes in the way individuals with partial sight confront visual impairment. The design and quality of spectacles and magnifiers has improved drastically, which provide larger field with minimum distortion at high power. We have now thinner high index lenses available with lighter materials, which are more acceptable functionally and cosmetically. Even telescopes have become smaller and lighter, and they provide much wider view than the conventional telescopes. Autofocus technology is now available in lightweight spectacle mounted system. The most promising technologies have emerged in the field of electronic and computer devices. As this generation of low vision patients, they are more familiar with cell phones, ATMs, computers, and video conferencing. So they more easily integrate these devices, into low vision aids. Electronic magnification, virtual reality goggles, which were initially developed for video games, they're also used as wearable display. They allow the viewer to see any text as if it was on a large screen. They are more and more being used by low vision patients these days. A truly miniature spectacle mounted system is also available it will be available in the near future. Uh, Now there is something called smart cane device. No, we know a person with blindness or low vision can generally detect objects on the ground, surface textures, potholes, but not the hanging objects like tree branches, signboards, open glass windows, etc. So we have this smart cane device available now. It solves the above challenges and empowers a visually impaired patient through independent and safe mobility. It basically uses an ultrasound ranging to detect obstacles and conveys distance information to end users through distinct vibratory patterns. It informs the person about presence of objects before actually touching the object, and thus helps in preventing unwanted contact. This is very easily available now, and is being manufactured in India also by some good companies. Now, learning to use optical devices, we should know multi handicaps should be paid more attention. We must always try in children so that they are able to cope up in normal school. The fellow children should be made to understand the problem of the child. Proper lighting and contrast should be provided in classroom, including chalkboard, especially where low vision children are studying. We should avoid a situation where a child has a feeling of helplessness, hopelessness, isolation, and depression. And family members should be involved, and they should be made to understand the patient's abilities and deficits. We must discourage common myths that using too much eyes can cause their current problem, or using too much can damage the remaining vision. Holding material too close is harmful. This is again a myth, because most of the low vision devices, we are supposed to hold the material close to the eyes. Sitting close to the TV is dangerous, maybe, but not for low vision patients. Regular examination is not required if there is an irreversible condition. So, to conclude, any patient with impaired functional vision by definition is a low vision patient. Increased awareness and knowledge both among patients and eye care providers is necessary. Training of low vision and rehabilitation should be part of basic training of eye residents. Many of the principles used during low vision assessment and management we easily integrate into routine ophthalmic practice. And ophthalmologists therefore have an opportunity to practice low vision every day, and should take into account, in addition to medical and surgical strategies, optical and rehabilitative strategies. So, all professionals who are confronted with people with severe visual problems should have good knowledge of many different forms of low vision and the broad scale of helpful devices and supportive conditions. Thank you.